Okay, so I'm doing an injury evaluation for injuries of the finger, hand, and wrist. So some history questions that I would ask the patient are, what increases or decreases your pain? Does the pain spread or radiate anywhere? How long have you been having symptoms? Do you feel tingling or numbness? What were you doing when the pain started? And what position was your body in when you were injured? For observation, I would look to see if the patient has edema, which is swelling, erythema, which is redness, bruising or discoloration, obvious deformities such as bumps, and then I would also look to see if the patient was holding their hand, wrist, or arm when they came in to the clinic for support.
Please palpate my phalanges.
So her phalanges are just her fingers. So this is phalange 1, 2, 3, 4, and 5.
Please palpate my distal phalanx.
So the distal phalanx is this one.
Please palpate my middle phalanx.
That would be the middle, this one.
Please palpate my proximal phalanx.
This one.
Please palpate my DIP joints.
That's the ones that connect the distal and middle phalanx.
Please palpate my PIP joints.
That connects the middle phalanx and the proximal phalanx.
Please palpate my MP joints.
So the MP joints are the ones that connect your metacarpals to the proximal phalanx.
Please palpate my metacarpals.
So the metacarpals are on just the palm of her hand, right here.
Please palpate my scaphoid.
Okay, so the scaphoid is, go like this and then rotate your wrist. So when the patient does ulnar to radial deviation, you can keep going. You can kind of feel it on the thumb side, and so hers is right here.
Please palpate
the hamate or the pisiform.
Yeah.
It's fine. You can just. Sorry. Keep it going. It's fine. Okay.
Okay,
yeah.
Please palpate.
So that is right here. It feels kind of like a little seed or a bead. It might be tender to touch sometimes.
Please palpate my thenar eminence.
The thenar eminence is this fat pad that's right under the thumb.
Can you do the previous one more time? I'm not sure if I got it correct.
That's like right here.
Okay.
Yeah.
Okay, please palpate my extensor digitorum profundus tendons.
So I'm gonna have you have your hand flat, and then can you lift your fingers? So these are the tendons that kind of stick out out of her fingers right here.
Please palpate my extensor pollicis longus tendon.
Okay, so now do the same thing but with your thumb. And so you can see that that's the long kind of tendon that sticks out and goes all the way to the top of her thumb.
Please palpate my extensor pollicis brevis tendon.
So that's also on her thumb, but it's a little bit shorter. It doesn't go all the way to the top, and hers isn't as prominent, but you can feel it.
Please palpate my anatomical snuff box.
So the anatomical snuff box, can you flex this again? Sorry. And so that's the area in between the extensors pollicis longus and the pollicis brevis tendons.
Please palpate my carpal tunnel.
The carpal tunnel is right here.
Please palpate my ulna.
That's the bone on the pinky side.
Please palpate my radius.
And that's the bone on the lateral side. On the lateral side, the thumb side.
Please palpate my styloid process of ulna.
That's this bony bump right here.
Please find my radial pulse.
Okay, so for that, I'm going to find her pulse and see how long or how many beats she gets in 10 seconds and multiply it by 6. So I'm going to find her pulse first. Okay, so in 10 seconds she had exactly 10 beats. And so multiplying that by 6, you get a total radial pulse of 60 beats per minute.
Please perform the Tunnel's sign test.
Okay, so Tunnel's sign is for carpal tunnel syndrome. And so the way that I do that is that can you pull your sleeve up? Okay, so I'm gonna start kind of lightly tapping at her carpal tunnel, and then if she feels tingling or pain, then that would be a sign. But if she doesn't, then I can start at her index finger and then work my way up to her forearm. And then a positive sign would be tingling or numbness in her thumb, index finger, middle finger, or the lateral half of her ring finger.
Please perform Phelan's test.
Okay, so for Phelan's test, I'm gonna have you go like this. And then if the injury is, this is also for carpal tunnel syndrome, and if the injury is like bad enough, then they should feel like a recreation of their symptoms right away. But if not, they might have to hold that position for about a minute or so. And then a positive test is pain, and then tingling or numbness in the thumb, index finger, middle finger, and lateral half of the ring finger.
Please perform Finkelstein's test.
Okay, so this is for de Quervain's syndrome, and for that, can you come like sit by me? Okay, so have your, relax your arm, and then tuck your thumb in and make a fist, and then I'm gonna have you push your fingers downwards. Keep your elbow on the table though. And so a positive test would be that they feel pain or tingling over the styloid process of the radius. And then if they don't feel pain, then I can assist them and push their wrist down for them, and that should create the symptoms. It's just a positive test would be like recreation of their symptoms, or the main one is pain and tingling.
Please perform valgus or varus stress test.
Okay, can you sit here again? So for that one, for valgus stress test, I'm gonna hold the patient's hand on the medial side and then their wrist right here, and I'm gonna kind of provide a force like this. And a positive test would be laxity or pain, and this is for collateral ligament tear. And then for a varus stress test, it's the same kind of thing, but your hand positioning is the opposite. So your this hand would be over here and this hand would be over here, and then you provide a force from the opposite side, and then a positive test would be laxity or pain, and this is also for collateral ligament tear. For those two, you should be able to kind of feel the laxity, obviously. So, yeah.